Chitrakala, shall I start?
Yes, yes.
Yeah. Good evening, Dr. Shadrajan ma'am, and good evening, good afternoon, Dr. Shama Sultan ma'am. This is Dr. Sumeshwar here. And uh, hi all. I cordially invite for the expert talk on cervical cancer awareness on cervical is preventable on National Cancer Awareness Day. So it's sponsored by the Shield Care and by the UNARI Healthcare. And let me introduce today's our moderator for the session, Dr. Muhammad Shama Sultana ma'am. She's a young, enthusiastic, and cheerful obstetrician and gynecologist, as well as an infertility consultant. And she's a chairman and co-founder of Hope Win Hospitals, and also working as a gynec consultant at Star Hospitals, Guntur. And also, she had a training in PG diploma in assisted reproductive technique from KL University, Germany, and she did her diploma in aesthetic gynecology, and she has colposcopy expert training from Delhi Gynec Forum. She has been a speaker on femicide, also on public awareness and in charge in sexual medicine committee Foxy, and editor in chief of Dr. Parag Patel's awareness e-digest of awareness magazine, as well as she also served as a faculty and moderator for Open Forum Awareness Adolescent Sexual Health organized by the Foxy June. And she's also founder of UNARI Healthcare Organization in Guntur for adolescent and young women health awareness mission. So with this, we welcome you, ma'am, as a moderator, and I hand over the session to you for the further proceedings.
Thank you for your introduction, kind words. And I just want to first play our UNRI's healthcare video. Please play.
YUVA's healthcare. Who is Yunari? She is adolescent girl and women who are the future of nation. They are in a journey to pursue their dreams. They need courage, determination, dedication, focus, and most important, health. They are surrounded by number of health problems. So here is our UNRI's healthcare founded by Dr. Shama Sultana, which shall provide awareness by online webinars, health-related videos, offline high school and college health camps, and many more. Our goal is to reach nationwide in 10 years. We need everyone's support. Thank you.
So that's our UNRI's healthcare mission. Good evening, everybody. Good evening, Sharda Jain ma'am. Thanks for accepting our invitation. So a few words on today's special day. Today is November 7th, and this is National Cancer Awareness Day. And this day, we want to make awareness from our side, UNRI's Healthcare Association. So no women should die from cervical cancer. This is our mission, and the burden of cervical cancer falls on the women who lack access to health services, mainly low and middle income countries. And as we all know, that is the main source of infection, and leading cause of cervical cancer is HPV infection. And there are more than 100 types of HPV, of which at least 14 cancer causing risk types are present, and HPV mainly transmitted through sexual intercourse. And as WHO says, that there is a primary prevention, secondary prevention, and tertiary prevention. Primary prevention as vaccination against HPV, and secondary prevention is screening and treatment of precancerous lesions, and tertiary is diagnosis and treatment of invasive and then palliative care. So previously means than this prophylactically or preliminary, we have to do awareness among the people about cervical cancer. So here are we with our stalwart and expert ma'am, Dr. Sharda Jain ma'am. She is an expert, and I always look upon her. And Dr. Sharda Jain ma'am is such a person who always inspired me for having such a type of burn in us to do a awareness program towards cervical cancer. So, Madam Dr. Sharda Jain ma'am is MD in PG JIPMA and MNAMS, FICOG, FIMSA, DHM, QMNAHO, PGDM, LS, Symbiosis, and Director of Life Care Center and Life Care IVF. Faculty for 2 decades at PGMR JIPMA, Lady Harding Medical College, founder and secretary general of Delhi Gynecologist Forum, member and expert of GYN in ethical committee of MCI 2018 to 2020, and again in National Medical Council from 2021 to 2023. She's decorated by Lifetime Achievement Award and Living Legend Award by many prestigious bodies. Passion, she's having an enormous passion, and I have seen by my own eyes, and I humbly say that she's having a burning passion on teaching safety of doctors and creating medical legal awareness. So I welcome you, ma'am. Please enlighten us on this cervical awareness, and over to you, ma'am.
Thank you. Give me 1 minute. I share the screen.
Yes, ma'am.
Just 1 minute. Can you see my screen?
Yes, ma'am.
I think today is a great day. 7th November, the Cancer Awareness Day, the National Cancer Awareness Day. I think Shama Sultana requires a special congratulations through her small NGO that, she wants to create awareness about many, many things. And today happens to be National Cancer Awareness Day. It is important. We all know that it's very unfortunate that 8 lakhs cancer cases we lose every year. And out of that, nearly 30 to 50% cancers can be prevented. But today we are going to talk on a cancer, which is the only cancer in a man and a woman which can be 100% preventable. And this is the highlight of my presentation today. Today, I'm going to talk about cervical cancer, the WHO call, and why HPV vaccination becomes a priority, why it has been neglected by gynecologists so far. I will talk about the focus on adolescent girls. I will also touch upon postpartum vaccination. I will also talk about male vaccination, HPV male vaccination, and probable questions which are faced by the doctors all around. I can say at the start is that, it's my mission that the country should become cervical cancer free. I'm the ambassador, and I wish all of you to join this particular movement. Now, as far as cancer service in 2021 is concerned, I can say that India is the capital of cervical cancer. For everything, because of our population is so much that we become capital for anything. Every woman is at risk of developing cervical cancer. 1 of 5 women who are dying of cervical cancer anywhere in the world is an Indian, 20%. And you'll be surprised, and the people who are listening me will be surprised to know that total maternal deaths in our country today in 2021 is 25,000. While the total deaths because of the cervical cancer are 60,000. So these deaths are more than double of the total maternal deaths in this particular country. So I think, the gynecologist, every lady doctor, every nurse has to put a focus here. They have done extremely well in the last decade by bringing down maternal mortality by 100 points. And if they put their focus on it, I'm sure we should be able to reach the goal, but the goal is far away. As I just now said, cervical cancer deaths are totally preventable deaths. We see something like 16 crores, and fatality of this cancer is 50% because we see them late. Legends words never die. And here's Louis Pasteur said, why talk of cure when you can prevent it? In prevention, you spend small amount of money, while in cure of a cancer, you require a big amount of money. And here is one reminder which to all of you is that cervical cancer is 100% preventable. There is no other cancer in a man and a woman which is 100% preventable. And this is the cervical cancer prevention pyramid. You can see the base. The base of prevention is vaccination, vaccination, and vaccination. Somehow gynecologists have not put their focus on it. They don't take themselves. They don't give it to their daughters. They don't give it to the daughter-in-laws. I don't know why. But I think the facts which I'm going to talk today, I again say that look at this base of cervical cancer prevention plan. The base is vaccination. It's our own ICMR study. If you give vaccination in a reproductive age group, 50% burden of the country as far as the cervical cancer is concerned will come down. As simple as that. And the secondary prevention is the screening for cervical cancer and the treatment of precancerous lesion. Because the treatment is 100% effective, and that's why we can say that if you have taken a vaccination and if you will get a regular screening done and your doctor is smart, you are 100% preventable. My boss used to say at PGI Chandigarh that anybody trained by me, in your care, any patient comes should not develop cervical cancer. And that's possible. Protection from HPV cancer is priceless. Shama Sultana has understood it, and that's why she's all out for it. Your one conversation with your patient may help her to save her life. So this adolescent girl, along with Delhi Gynecologist Forum members, are making an appeal that gynecologists, lady doctors, nurses, volunteers can make a lot of difference. This shows that we lose 8 lakhs people from cancer today. As you can see here, as for the woman is concerned, the breast is number 1. We see around 1.6 lakhs cases. Cervical cancer, the figure stands corrected today, is 1.25 lakhs. Question comes, does HPV cause only cervical cancer? Why HPV diseases need to be prevented in India? Here you can see here that cervical cancer, it is 100% the underlying cause. As far as vaginal vulva is concerned, around 50 to 60%, penile cancer 50%, anal cancer 90%, and oropharyngeal cancers, again, around 25%. Now this gives us a picture. What is the impact globally of HPV infection? 66 crores is the underestimation. Out of that, the cervical cancer makes something like 6 lakhs, around the globe. High-grade dysplasia are around 10 million. Low-grade dysplasias are 30 million. Genital warts are around 30 million. And beside this, there are cancers which are HPV related. Now, this particular slide of 2021 shows that the age-adjusted incidence for LAC population, as for the cervical cancer in India is concerned, is 15. 15 out of 1 lakh have cervical cancer. This gives you a rough figure. The annual incidence in our country is 1.23 lakh. Vaginal cancer, anal cancer, vulval cancers are around 5,000 per year. Genital warts make 1%. HPV infection in Indian population is around 6.6%. And CIN1, CIN2, and CIN3 total make something like 4%. This particular slide is very dear to me. It is said that a Boeing full of nearly 200 women with cancer cervix crash every day in our country. And still, it doesn't make a cover news of the national dailies. There's no emergency cabinet meetings. A bridge is broken, there will be emergency cabinet meeting. But here a woman is dying and there is no uproar in this country. Now, this is what WHO says. We thought, myself, Dr. Sultana feels, we'll be able to overcome cancer cervix overnight. No. If you put a mind on it that you want to eliminate cervical cancer, it is going to take next 100 years. Provided our strategies are critical and we are focused. 100 saal lagenge. The Western world has shown they have been working on it for the last 65 years. They had been working on cervical cancer screening. They could decrease the disease by 80%, and they could decrease the deaths because of the cervical cancer in 70%. Now they have realized whatever screening they may do, if they do not add vaccination to their program, they can never be 100% effective. Australia is on the verge of getting declared as cervical cancer free. And once Australia is declared, many European countries will follow the line. We have to still start our first step. The WHO had given a clarion call in November 2020 that the rule is 90, 70, 90. 90 is the vaccination, 70 is the screening for cervical cancer, and 90% cases where were detected to have precancerous lesions should be treated by the gynecologist. Now, as for the Western world is concerned, their screening is great, something to the tune of 80 to 90%. Their doctors are trained and they can 80 to 90%, they can treat precancerous lesion effectively. And now they have added vaccination program in their kitty. So just now I said that they are on the verge of getting declared free of cervical cancer. Now, as far as we are concerned, you can see here, our screening is just 3%. We claim we're a body of 40,000 people. Another 40,000 people are working as self-styled gynecologists. Colossal number of nurses we have, and still our screening is just 3%. As far as the vaccination is concerned, somehow the gynecologists are allergic to vaccination. Pediatricians do 3/4 of the HPV vaccination in this country. contribution is only 25%. Upar se. And that is why we contribute 0.1%, not even 1% to the HPV vaccination. And when it comes to treating the precancerous lesions, I've trained 3,500 people. My feedback by the gynecologist says they don't know anything. Their humble submission is they don't know anything. 10% can effectively treat CIN cases. So we have to really skill them. पर स्किल आदमी उसी को करेगा ना जो जिसको ये एहसास होगा कि मुझे नहीं आता. What should India do? $90, $70, $90. We all know it for very well that the focus is vaccination in the reproductive age group. 9 to 45 years, the studies have been done, and the government in India gives the same sanction. Foxy gives the same sanction, and Pediatric Association gives the same sanction. But if we don't have the money, unless the government of India spends on adolescent vaccination, which is very easily possible, because 95% of our girls finish up to class 5. By hook or crook, 5वीं क्लास तक तो जाते ही जाते. अगर 5वीं क्लास तक वो पढ़ते हैं तो उनको वैक्सीनेशन देना बहुत आसान है. 2 वैक्सीनेशन दें. Secondly, we have to start. I again say we have to start and scale up screening and the treatment of precancerous cervical lesion. There is a recent trend which I can see in the last decade, that the gynecologists do not put speculums. So my humble request to everybody is, first speculum examination is the part and parcel of gynae examination. And thirdly is, if you can't screen people between 21 to 65 years, at least do it twice. Don't do Pap Smear if it costs the money. If she does not come for a follow-up, just do it VIA and Willy at 35 and 45 years. And if you just screen them for precancerous lesion at this particular stage, let them come for a 1 visit, whether in a camp setting or your clinic setting. You do a VIA, you do a Willy. If you find suspicious, treat them then and there with cryocautery or thermal ablation. And you can now, this is a WHO aims to set the world on the right track by 2030. The developing world is already doing it. They have to just add on vaccinations. But as far as we are concerned, the people who come from developing countries, they have to be set on the right track by 2030. That is next decade. If the action is taken, the deaths can become 1/3 as a result of cervical cancer. But if no action is taken, then the deaths because of the cervical cancer will rise almost by 50% by 2030. अगर आप काम करोगे तो आपकी deaths 1/3 कम हो जाएंगी. अगर आप काम नहीं करोगे तो आपकी deaths 50% बढ़ जाएंगी. So one has to decide what one wants to do. Again, WHO says, look at these girls. Elimination of cervical cancer is possible within the lifetime of today's youngest girl. But the clock starts now. Every intervention by every doctor, nurse counts. The women of this country are very hopeful. Gynecologist members are also very hopeful that the people will rise to the occasion and we'll get onto the right track. I come back to the same slide. As far as the scenario of HPV vaccination in this country is concerned, it is less than 1%, and the share by the gynecologists is disparate. As for the cervical cancer screening is concerned, we stand at 3% only. And this slide summarizes. In 2021, we lose 60,000 cases because of cervical cancer every year, in comparison to only 25,000 maternal deaths across the country because of pregnancy and childbirth. 40% our patients are just beyond 40 years when the woman is needed most in her family. And when she is most productive age group, we lose her. 1% immunization, and every fifth person who is dying of cervical cancer is an Indian. Now, coming to the HPV vaccination. This is 2020 WHO report on cancers. And according to WHO, HPV vaccination has the highest impact. If you give 1,000 vaccination, we save 20 lives. No other vaccination comes near it. The next one is hepatitis B. You give 1,000 vaccination, you save 10 lives. This particular slide must be remembered by everybody who's watching this. WHO says this, Gavi says this, that HPV vaccination has the highest impact in survival of people's lives. WHO, the American College, the other bodies, the nurses, that the gynecologists and nurses can play a critical role in women's care, in vaccinating adolescent girls and a woman of reproductive age group during the catch-up period in case they have not been able to take it earlier. We have to work for these adolescent girls. Our focus should be on these. This does not mean that a woman of 50 years cannot take the vaccination. I will show it from my subsequent slide how effective the vaccination is. Now, question is, adolescent girls, how they have to be vaccinated. One thing is very clear, less than 14, WHO white paper says they require only 2 vaccinations. One today and one 6 months later. If you give at the gap of 5 months, you have to give 3 vaccinations. If she's past 14 years, then the vaccinations have to be 3. Ensure immunization is completed prior to potential exposure to sex. Pediatricians sell this particular vaccination as cancer vaccination. They don't call it cervical cancer. They sell it as cancer vaccination. It takes care of the cervix, it takes care of the vulva, it takes care of the vagina, it takes care of the anal canal and oropharyngeal cancers. So they told me, Dr. Jain, don't ever say that it is cervical cancer vaccination. Tell them that it is a cancer vaccination. And when you say, mention throat, everybody knows about throat vaccination, throat cancer. 4 reasons why we should focus on adolescent health. जब हम कहते हैं हमारे पास पैसों की कमी है, they have the higher immune response. But the experts say antibodies levels have never been sorted out. The efficacy is not because of the antibody levels. Secondly is the cost of immunization is less because you give 2 vaccinations instead of 3. And then earlier they're exposed to sex, the more problems they have. Because the epithelium is not mature. And at this particular time you give, they have highest possible efficacy. And these are the 4 reasons why we should focus. And if you give the vaccination early, it is said 5 times higher risk of developing invasive cancer if the first intercourse had been prior to 18 years compared to the people who have been exposed to sex after 22 years. And these are 4 reasons that not only adolescent girls, we should focus each and everybody in the reproductive age group. PICO says this, Foxy says this, API says it, Ministry says the same. And between 9 to 45 years, we have 400 crores. Aap ginte jaiye. Number will never end. They're waiting to be vaccinated. And the gynecologists are the best position because they know, they deal with that uterus, cervix. They know everything what need to be dealt with it. In India, the gynecologists see majority of the girls once the girls are married and they are pregnant. Very few come earlier than that. So it is only the counseling at our part that we need to motivate them and their parents about the vaccination. Now, if we miss out, as we said, that majority of the gynecologists see a woman for the first time only when she's pregnant. So you counsel them at that particular time. And a postpartum vaccination is very effective. One thing, they need it. HPV vaccination is highly effective during this particular time. They accept it very easily. They complete the full vaccination schedule, and they're highly satisfied at this particular stage. And here I wish to only tell you that only Gardasil can be given. Cervarix cannot be given because they have not done any study anywhere in the breastfeeding woman. So I again repeat, the doctors and the nurses can make a lot of difference in the life of a girl and a woman, and they will not allow them to miss any opportunity to protect themselves from cervical cancer by vaccinating them. Now coming, why protecting boys against HPV is important. Majority of the women, the HPV infection clears off by age 30. But in case if it persists, it will lead to certain cervical cancer and precancerous lesions. As far as the men are concerned, males remain susceptible to HPV infection throughout their life. Unlike women, the male remains susceptible to HPV infection throughout their life. HPV prevalence among men in India is around 26%. But a woman who has got cervical cancer, the HPV prevalence among their males is around 67%. And that is why the impact of HPV disease burden and the cancer will be if you use a vaccination which has broader serotype. In Gardasil 4, you have 4 viruses, while in Gardasil 9, there will be additional more 5 viruses. And now on the 1st of October 2021, this particular vaccine has come in this particular country. It will be in a short supply, so it will be only available in metros. But it has 9 oncogenic virus, so it gives a broader cover for prevention of cervical cancer and other HPV-related cancers. Safety profile is superb. In case any other vaccination is given along with Gardasil 9, you'll find that there is no adverse effect. The safety profile is superb. Now, these are probable questions on prevention of cancer cervix, which gynecologists face from time to time from the parents, from their own colleagues, from the other people. We face bad COVID times, patients hardly come. How do we tackle this vaccination during COVID scenario? I can only say teleconsultation has been cleared by the National Medical Council, and make utilization whenever you have a time to converse with your patient. Talk about this vaccination too. Because COVID vaccination has created a silver line Everybody knows vaccines are good for prevention of disease. So they have the acceptability in masses has increased tremendously. Counseling is an art. And every art one can acquire. It should be talk precise, talk quick, talk emotional. I've taken it, my daughter has taken it, my daughter-in-law has taken it, my sister has taken it. You should also take it. So you say, if you love your wife, if you love your daughter, for benefit of their health, join hands with us and let's prevent a cancer by action today and today only. Don't talk much of science. Percent, immunity, sexually transmitted disease, these words should never be used when you're counseling. I have done it, you should also do it. You are the perfect example. Now, again, this is gynecologists always say screening is enough for preventing cervical cancer. Then why vaccinate? Look at the Western world. 60 साल से काम कर रहे हैं, 70% पे पहुंचे. इनको पता चल गया कि जब तक वैक्सीनेशन नहीं देंगे 100% नहीं होएगा. You have to also do the same. This myth in gynecologist mind has to go. Vaccination is the base of the cervical cancer pyramid. This study has been done by ICMR, quoted all over the world, very much respected. It says that if you give a vaccination alone in a reproductive age group, you can bring down the disease burden of the cancer cervix by 50%. If you combine with 3 cervical cancer screening, it can be 61%. If twice screening you do and you combine with vaccination, the protection will be something like 60%. So this particular message is very strong. You don't need to do Pap Smear. You can do VIE and VILI, which is equally effective as Pap Smear. CDC, everybody looks up to CDC for guideline. It says cervical screening is not alone. Protect these women with HPV vaccination now, along with screening. Postpartum vaccination again, gynecologists only say, isn't it too late to vaccinate? Here I always say, from birth till the time the woman goes up, the incidence of HPV infection keeps on increasing. Every time she's exposed to sex, she gets a new virus. I repeat again, every time she's exposed to sex, she gets a new virus from the same man. So risk of progression of the disease from CIN1 to CIN3 is also 7 times higher for a woman who are more than 30 years in comparison to the women who are less than 20 years. As far as efficacy is concerned, HPV infection 100% can be prevented. As for the efficacy in LSIL or worse disease, again 100%. And we have a solid data of last 13 years that there is no breakthrough. Do I need to vaccinate my patients if she is sexually active? Again, this is a myth. It's gone in their mind. Vaccination का कोई फायदा नहीं after once she's exposed to sex. No, you're wrong. This study has been done with Adolescent, and they found that only 0.1% women are infected with all 4 viruses which are included in Gardasil vaccination. And that is why if you give a vaccination in sexually active women between 18 to 26, it is 99.9% effective. And if you give a vaccination again in a group which is 24 to 45 years sexually active women, if you give this vaccination, again, it is 99.9% effective. So everybody who's listening me should know that efficacy in sexually active women is almost the same. These are not my figures. This is all there in public domain. The patients are concerned about the safety of the vaccination. Gardasil 4, Gardasil 5, that are 9. Now we know it that 7 phase 3 trial studies have been done covering 30,000 people. Again, after the license, 1 million subjects studies have been included. More than 300 million doses have been dispensed worldwide till 2018. And these big 9 bodies, WHO, CDC, WIGO, FDA, everybody approves and says it is safe vaccination. CDC, WHO, every complaint is taken care of and has got 100% clearance. This particular vaccine is not related to infertility. Any new vaccine comes, people relate it to infertility. It has nothing to do with infertility. And as far as the 2 vaccines which are there, as for the cervical cancer is concerned, both are 98% effective. And as far as Gardasil 9 is concerned, it's maybe a little more. What about HPV vaccination, whether it's safe for lactating mothers? You can only go by guidelines. ACOG says vaccination can be given to breastfeeding mothers. CDC says the same thing. WHO says the same thing, that it is safe during lactation. Another question is often asked. You give vaccination early, the disease occurs after 40 plus, you don't even give a booster dose. So you can say that we have data of 13 years. 2008, this particular vaccine came in this country. 2006, it came in the rest of the world. And now you can see 13 or 15 years data shows there has been no breakthrough. How do I complete HPV vaccination schedule now during this COVID times? It has been said earlier, it was said within a year it should be completed. Now the body says whether 2 doses regime or 3 doses regime, it should be completed within 3 years. Why we should use quadrivalent vaccine? That's my choice. It is efficacious in sexually active women, they have shown by the study. It is proven effectiveness on a long-term follow-up. No breakthrough. It can be given to lactating mothers, studies show, and it has got high safety profile. So while protecting women, the government of India should not miss out on a single adolescent girl, and they should be vaccinated during the adolescent time. When Gardasil 9 has come, I will say, while protecting girls, parents should consider vaccinating adolescent boys with Gardasil 4 and Gardasil 9. The age prescribed for them is 9 to 15 years. That's an apt age for them. So I want to become a volunteer or an ambassador of 90-70-90 program of WHO. How do I complete? I will say, do a simple screening, forget about Pap Smear. Do VIA willing. Make an assessment whether you are seeing an abnormal findings you're getting or whether they're normal. If they're abnormal findings, do simply cryo or thermal ablation. Give 1 dose of vaccination. Forget about the 2nd and 3rd. Maybe in 2 years' time, WHO will say that 1 dose is enough. And I will say that we run a very comprehensive course on cervical cancer prevention, where we teach each and everything about HPV vaccination and many small things which the government of India envisages as a low resource country, that is VIA, WILI, and how to go about with it. With a single visit, clinic visit, and advanced colposcopy also we treat. So this is what we feel that, each one of the person who has not done it, it is an 8-hour course spread over 2 days, and it is totally online course. You'll be as satisfied as your presence are there in the clinic. It is wonderful online course. Effective HPV vaccination, screening, and a great counseling by you. And the strong recommendation is all it needs to protect this particular girl and a woman from the cervical cancer. I'm the ambassador of this 90-70-90 program. I wish you also should become the member. I again say, protection from HPV cancer is priceless. Your one conversation can make so much difference to save her life. Thank you very much.
Thank you so much, ma'am. It was very, very interesting and very eye-opening presentation by you, ma'am. And that's why, ma'am, I was so sure that we will be very much enlightened by you, ma'am. Few questions. I had many questions, but
Yes.
After this presentation, many of the questions were answered by you along with your presentation, ma'am. Maybe these few questions also are answered in your presentation, but I want to precisely ask, ma'am, separately. So
Yes, yes.
one of the question, like I'm 28-year-old with excessive white discharge and foul smell, and it is repetitively coming in every year, and I have a fear of any serious problem. So please help what to do.
I think they should reach the gynecologist or any lady doctor who has been trained in cervical cancer prevention. She will do a speculum examination. She will do a VIA, Willy, and after thorough examination, will be able to tell you that whether you are having a problem or not having a problem. You can take it from me. Whenever there's an excessive vaginal discharge, there is some pathologies there, and the people must be instructed that they require an examination. And at the same time, my request to everybody who's watching me is that annual examination should be made mandatory for each and everybody, whether they are rich, whether they are poor, whether they're urban, whether they're rural. Everybody requires annual examination done by a lady doctor. So they should be able to not only thorough examination, screening the various medical disorders, but also they will be screened breast cancer as well as cervical cancer.
Yes, ma'am. Thank you, ma'am. Another question, like I'm 33-year-old and blessed with 4 children at the age of 22 years. My last childbirth was at 22 years, and now I have a heavy white bleed with lot of weakness and backache. Please suggest what to do.
Ma'am, it is just the same that you need to go to a lady doctor. I might do apologies by lady doctor to any doctor who's supposed to see a lady there, and get a thorough examination from top to toe, and you will find that there will be some answer will be given, and you will be taken care as far as your backache is concerned, as per your discharge is concerned, and also you'll be advised to go for any tubal ligation or if it is needed.
Yes, ma'am. Thank you, ma'am. This is related to corona, ma'am. The question goes like, can my 19-year-old girl take cervical cancer vaccine who had taken corona vaccine last month and suffered from corona in March this year?
See, as far as corona vaccination and the other vaccinations are concerned, it is very clear that their advice by the government is that no vaccination should be taken in the next 15 days. After that, she can take it.
Okay. Thank you, ma'am. Along with your presentation, you have spoken about this, ma'am, but separately, I want to ask, can we take HPV vaccine during pregnancy or in breastfeeding?
See, as far as pregnancy is concerned, HPV vaccination should not be given. One thing is very clear. It is not the vaccination for pregnancy. But as just now I said, as soon as she has delivered, she can take postpartum cervical cancer vaccination. She can write in the hospital, she can take it. So during breastfeeding is absolutely safe. There is enough data.
Okay. Thank you, ma'am. Another question. I'm 40-year-old with a fear of contacting cervical cancer as my mother died of cervical cancer. Now, as vaccination awareness is there, now can I get vaccinated and how can I do it?
See, the question is, let me be very, very clear about it. Cancers goes in families. My father has had cancer, my uncle has had cancer, my brother has had cancer. I am also prone to it. One thing one should be very clear. Secondly, if you want to get it prevented, nobody stops you from taking vaccination. Vaccination will arm you well. At 40 years, 45 years, safely you can take it. People like me took it at the age of 60 years. If the screening can go on till 65 years, if the vaccination is 99.9% effective at the 45 years, if I want to take, I can take it at 60 years also. Clear? One thing. Secondly is, they will examine you thoroughly, especially in you whose history is there that the mother has had a cervical cancer. After thorough examination, they will do, if you're in a posh clinic, they can do a Pap Smear, they can do HPV high-risk DNA panel for you, and they will let you know whether the disease has got a problem, whether the cervix is healthy, cervix is not healthy. Then they will brief you everything. But if I'm in a rural setting, I can have a VIA, I can have a VI, and I can have, if there's something abnormal, they will refer it to me into a screen and treat clinic, in a proper clinic where the colposcopy facilities are available for biopsy, or in case if they find that there's nothing alarming, they can treat right there with the cryocontry.
Okay. Thank you so much, ma'am. And the question is like, I'm 34-year-old and in my last gynec checkup, I was diagnosed with low-grade squamous intraepithelial lesion in Pap Smear. Can I get vaccinated now and also treated as well, or vaccination is enough?
मैडम मुझे समझ नहीं आया, एक मिनट मुझे बताइए कि अब मेरे को दोबारा क्वेश्चन बताना पड़ेगा आपको.
Yes, ma'am, sure, ma'am. She is a 34-year-old, ma'am, and in her gynec checkup, last gynec checkup, she was diagnosed with low-grade squamous intraepithelial lesion in Pap Smear. So she's asking, can she get vaccinated now? Will it be useful? Ma'am, okay, we'll wait for a few minutes. Please, anybody have questions, please post. Please post your questions. Until then, I will try to contact ma'am. Yeah, we shall take this one question in the chat box. If a person has taken first dose of Gardasil 3 months back, can she take her second dose now, or should we start again? As we have covered in the MAAM's lecture, that it could be done within 1 year or so. So yes, we could take the second dose now. No need to start over again. First dose, then we can take the second dose now, and then after 6 to 8 months of second dose, means first dose, you can take the next dose within 1 year. So we shall wind it up now. So thank you. I will propose the vote of thanks. So I thank our chief guest and speaker, Dr. Sharda Jain ma'am, who have immediately accepted our invitation in her busy schedule and given an eye-opening and wonderful message-oriented presentation. We are so grateful to you, ma'am. And I thank all the delegates who have joined and make this webinar a success, and hope all will join in our each and every program of YNHC and take enormous awareness from us. And I thank our technical support team as well, and thanks for your support, Shield Healthcare, for your continuous and amazing immense support for our technical support. So I wind up here. Thank you so much for joining with us. And Sharda Jain ma'am is here with us.
I'm sorry, my connection went off, you know. Good that it went off at the end of my talk.
Yes, ma'am. Thank you so much for joining us, ma'am. I was proposing a vote of thanks, but here 2 questions are there in our chat box. I was trying to solve it, but as you have come, I want to ask it again, ma'am. So the question was like, if a person has taken first dose of Gardasil 3 months back, can she take her second dose now, or should start again?
No, there's no point taking it again. Whatever you've taken, you should restart again. So if a 3 months gap has gone, you take a second dose now, and then the third dose you can take 3 months later.
Yes. And
instead of 1, 2, and 6, you can take it at 1, 3, and 6.
Okay. Yes, ma'am. Thank you, ma'am. The question was like related to the schedule. After 24, it's 2 or 3 doses.
After
24 years, is it 2 doses or 3 doses?
3.
Yes, as ma'am already said that from 9 to 15 years, it is 2 doses, and after 15 years, it is
9 to 14. Till now, 9 to 14. When the WHO says that this year they will submit a white paper again, then only it will be 15 years. But it is till now, it is 14 years.
So 9 to 14, it is 2 doses. Then from 15 years later, it is 3 doses. First 2 doses, it is 0 dose on the 0 day, and the next dose, it is 6 months.
Yes, 6 months plus.
Yeah, then 3 doses, it is first dose on the 0 day and second dose on 2 months, and the third dose from 6 to 12 months.
And one should not get worried. Within 3 years now, in the corona time, it has been said by the WHO and by these vaccine companies that within 3 years it can be completed, and you don't have to repeat anything.
And ma'am, recently I have listened the news about 1 dose is sufficient for vaccination for lifelong.
Let me be very frank with you. What did I say in my last slide?
Yes.
What I need to do? I need to know. I should be able, if I'm sitting in a rural area, I should be able to see, know VIA कैसे करते हैं, विली कैसे करते हैं, उसका इंटरप्रिटेशन कैसे करते हैं, उसको ट्रीट कैसे करते हैं. सिंगल विजिट में आपने सारा काम खत्म कर देना है. अगर आपको लगे कुछ गड़बड़ है, उसको आप स्क्रीन एंड ट्रीट क्लिनिक में भेजो, जहां पर भी कॉल्पोस्कोपी की फैसिलिटी अवेलेबल है, जहां पे वो कॉल्पोस्कोपी करेंगे, बायोप्सी करेंगे, ट्रीट करेंगे. क्लियर हो गया? नाउ if the person has come in our setting, we can do whatever we want. One thing should remain, that we must give them the vaccination and we must treat them well.
Yes, ma'am. Another thing I thought, like I was approaching one of the politician here, means he has come here for inauguration. So I was telling him that why not we approve our Pap Smear as a basic test, like somebody is coming to our hospital as she's married and she's having little problems with the operation.
The limitation of the Pap Smear is that, the lady has to come for a second visit. Now the plan has been there in all developing countries as far as WHO recommendations concerned, whether the Africa or for us, is that, this lady should come only once, whether she comes in a clinic setting or whether she comes in a camp setting. You see her, VIA, Willy, and treat her. In our clinic also, VIA and Willy and treat her. But this does not employ to a person who has got a postcoital bleeding or a postmenopausal bleeding. They have to come for a regular thing. Single visit mein kuch nahi hoga unka. Yes, your upper class 3%, your middle class 12%, you can do anything. Pap smear, high HPV screening, anything you do. The India is divided between 85% who are poor and 15% who are middle class and upper class. With middle class and upper class, you can do anything you like. आप उसमें भी करेंगे, आपका जो screening rate तो 3% है ना.
Yes.
So you have to see to it at what is wrong at your end. Conventional Pap smear is as good as LBS. It has no advantage. The only thing what people should do is, if you're taking a Pap smear, make sure that this lady is going to collect your smear. If she cannot come for a collection of the smear, there is no point doing a Pap smear. Do VIA, do Willy. Make up your mind. Whether it is acetowide grade 1, whether it's acetowide grade 2, whether it's acetowide grade 3. And I don't have really teach precancerous lesion here. As far as CIN3 is concerned, there is no place for conservative treatment if she has completed her family. And that's a discussion by itself. My only request is the people who are watching me and who have not done this particular program, please do comprehensive cervical cancer prevention course. It is in 8 hours, totally online, and I can make sure that you will know everything. You'll know everything.
Yes, ma'am. One more question.
We will make you absolutely solid.
Yes, ma'am. Question is like, ma'am, my mother is about 50 years old and now she has some white discharge. Which type of medical care she needs?
See, the question is, anybody who is postmenopausal has no business to have any discharge. She requires thorough examination.
Yes, ma'am. Yes, ma'am. So I will propose the vote of thanks, ma'am. Thanks for coming, and I thank our chief guest and speaker, Dr. Sharda Jain, ma'am, who have immediately accepted our invitation in her busy schedule and given an eye-opening and wonderful presentation. And we are so grateful to you, ma'am. And I thank our technical support team, Shield Healthcare. And last but not the least, I thank all the delegates who joined us and has made this webinar a success. Thank you so much, ma'am. And thank you so much, everybody. Thank you. This is our token of your appreciation, ma'am. Thank you so much for joining.
Thank you. Thank you very much. Thank you very much.
NARI'S Healthcare.
Great.
Yes.
Thank you very much.
Thank you, ma'am.
Welcome.
Yes. So we will end up the session here.